Tingling in your arm and hand is disturbing. Not knowing what's causing that tingling in the first place can lead to sleepless nights. And if you're not sleeping correctly, you're not healing, which means whatever is causing that tingling is not going to get any better. So today we're talking about what could be causing the tingling in your hand or even your arm. First off, before we discuss what's going on in the arm, let's discuss what's going on with the neck. So in your neck, you have 7 cervical vertebrae. So your vertebrae are what make up your spinal cord. So those are the bones, and they have discs in between. Now, each of the vertebrae has a nerve root that's coming out underneath it. In your neck, those nerve roots go down into your hand. So most commonly, if you're having numbness and tingling in your arm or hand, it's coming from your neck. Now, I hear you might be saying, well, what if I have carpal tunnel syndrome? Carpal tunnel syndrome is actually when you have pressure in the carpal tunnel, and that leads to hand numbness and tingling. So yes, if you have carpal tunnel syndrome, that can be coming directly from that carpal tunnel. I understand that. But most commonly, when people have numbness and tingling that's going down their arm and their hand, it is actually coming from the neck. And I dare say that even if you do have carpal tunnel syndrome, you still might be having some neck dysfunction that is putting increased stress on those nerves, and that the carpal tunnel is just the end point of where it's getting really disturbed. I know this is true because I've seen many people have carpal tunnel surgery and get a relief from their symptoms temporarily, but they end up coming back over time because they never dealt with the neck issue that was also putting pressure on the nerves. So those exceptions aside, what we're going to talk about is what could be putting pressure on the nerves in the neck that's causing the arm numbness and tingling. First off, the most common cause of arm numbness and tingling is a herniated or a bulging disc. So you have those vertebrae, which make up your spinal cord. In between, you have the shock absorbers. Those are called the discs. Now, they can bulge out, which is they kind of form a pocket that sticks out, and that can cause pressure on the nerve, because remember, the nerve is coming out right next to the disc. Now, if that bulge isn't treated properly, it can lead to a herniation. And what that means is that the discal material has escaped the discal borders, and it is now out, and it is bathing that nerve, which is really irritating to the nerve. Now, nerves are dumb. All they know is I'm irritated. So that pain signal you get is your nerve saying, I'm irritated. It doesn't know why it's irritated. It doesn't know that it's necessarily a disc or a joint, or it doesn't know what's going on. It just knows I'm irritated. So I'm going to send that pain signal so that you'll help me get rid of this irritation. Another common area of nerve compression that leads to numbness and tingling, particularly in the hands, is called thoracic outlet syndrome. Now, what that is the nerves, after they come out of the neck, they mix together through this area here, basically through your armpit. And in that process, they go in between the clavicle, the collarbone, and the first rib. So your first rib is actually way up here. It's right underneath the collarbone. And if you kind of poke in underneath, you can be like, oh my gosh, there's a rib up there? Yeah, seriously, there's a rib up there. It's easier to feel on your back if you want, if you kind of put your hand like right up in here, and you may feel like there's this really tight, tense area of muscle. That's actually your first rib. That's where all the muscles are attaching on your first rib. So that's a random fact for the day. But yes, your first ribs are really high. And so the nerves go in between the clavicle and that first rib, and that can be a compression point. Most commonly, that will cause numbness and tingling down in the hands. You may have a little bit in the arm too, but most commonly people who have that problem have it in their hands. And it's because those nerves are getting extra compressed as they go through that thoracic outlet. If you're having bilateral numbness and tingling, what may be happening for you is cervical spinal stenosis. So what can happen is over time, as we age, with gravity pushing down on our spine, we can get abnormal bone formation, which causes increased pressure on the nerves. Often this will happen on both sides fairly equally, or it will happen in the middle and it'll affect both sides. So you'll start to have numbness and tingling in both hands at the same time, because obviously the vertebrae in the middle of your body are usually pretty much affected the same on both sides. Now this gets tricky to deal with because we need to make sure that we keep as much room as possible for the nerves to be able to move properly. But if you have abnormal bone formation, that gets a little bit more difficult. You definitely need to make sure that you're working with a provider who can be really, really clear on what it is that's safe for you and your body to do. Now, we can't make a video about hand numbness and tingling without talking about the potential of heart attack. Now, if you are having numbness and tingling in your hand, especially that comes on suddenly, especially that comes on at night, that you've never had before, you need to be looking for other signs of a heart attack. So that would be shortness of breath, that would be intense pressure on your chest. You may even have some symptoms of indigestion. Most commonly, people talk about arm numbness and tingling in the left hand, but there is some research out there that's saying for women, it may be more common to have numbness and tingling in the right hand. Now, I'm not trying to cause fear, but I do want you to be aware of the other signs of a heart attack, because obviously if you're having a heart attack, you need to call emergency medical and get help as quickly as possible. So if you start having a sudden onset of numbness and tingling, again, you're looking for shortness of breath, intense pressure on the chest, potentially a feeling of indigestion or your stomach's upset, you need to seek emergency medical attention because we want to make sure that you are just as safe as possible. So there's a discussion of different structures in your neck that can be putting pressure on the nerve and causing numbness and tingling in your hand. Now, what can you do about numbness and tingling in your hand or even neck pain that may be causing that? I'm going to recommend you check out these videos here for more information. If you want to understand more about how your whole body is connected, then I recommend you check out my book, Movement is Life. We'll drop a link below.